Good afternoon, everyone. I would like to welcome you to our coronavirus update in response to how they affect employee benefits. My name is Kirsten Kornblum with Benefit Concepts. I'm president of the agency, and I am thrilled to announce that Stacy Barrow, who is a nationally renowned ERISA attorney, is going to lead the conference for us today. We are at full capacity, so if you have friends or coworkers that are trying to join, I apologize that they're not able to attend the live version, but it is being recorded, and as soon as it's available, we will distribute it out via email, as well as on our hub, which is where you can find us on our website at mybciteam.com to get up-to-date information, webinars, important links, and carrier updates. So without further ado, we've got a long presentation, very meaty information, and we want to leave ample time for Q&A. So I'm going to turn it over to Stacy Barrow at this time to take us through this very important information. Thank you so much, Stacy.
Thanks, Kirsten. Thanks for having me here today. This is Stacy Barrow from Barrow, Weatherhead Lent. So this is certainly an interesting time. And before we jump into anything, I think no one out there has dealt with this before, anywhere in the world really, and certainly not in the U.S. So there'll be a lot of I think learning as everybody goes along. I think as Americans we'll get through this together, but we may need to weather it out here. I think we're just starting to feel the effects. So I'm going to talk just very briefly about the COVID-19 background, what we've seen employers do in response. I'll talk about some of the guidance from the federal agencies like the IRS and Department of Labor. And then for the most part, we'll talk about the Coronavirus Response Act, the two paid leave components of that, and then common benefits and employment law issues. So this virus is actually a form of SARS, apparently, SARS-CoV-2, and the disease is COVID-19. And it was only a little over a month ago where the World Health Organization declared it to be a public health emergency. And I think many people, even into February, were thinking that this is something that affects folks on cruise ships and maybe other countries. And the name COVID-19 wasn't even coined until the middle of February. It became a national emergency in the U.S. a couple of weeks ago, right after the World Health Organization declared it to be a pandemic. And about a week ago, we had 2,000 cases in 49 states, including D.C. 6 days later, I think we're closing in on 20,000 cases. Now that we're doing more testing, the number seems to keep going up. It's in every state in Washington, D.C. It's in all of the U.S. territories. The illnesses range from being very mild to increasingly severe, up to and including death. Symptoms include fever, cough, and shortness of breath, and may appear 2 to 14 days after exposure, although we're hearing that sometimes it can be as long as a month. The information so far suggests that most illness is relatively mild, but serious illness is occurring in a substantial number of cases. In fact, nearly 40% of people sick enough to be hospitalized are aged 20 to 54. So it's not just affecting older people, although those who are older and have serious chronic conditions are much more likely to develop complications from this disease. And it spreads very easily from person to person via coughs and contact and other sneezes. It does not seem like we'll get a vaccine prior to 2021 at the earliest. We're hearing about all these preventive measures, social distancing, self-isolation. We are already seeing many schools and workplace closures around the country. Large gatherings are canceled. Again, folks self-quarantining. We're hearing to wash our hands often, avoid touching our face. We did see that, according to the World Health Organization, they're only recommending the use of masks if you're sneezing or coughing or caring for someone with a suspected infection. The initial employer responses, I think we're past a lot of this already, but employers have educated employees on COVID-19, spread prevention techniques, just enforcing stay-at-home policies if employees are sick or symptomatic. And we are hearing that many employers are having employees work from home until further notice. And I think as of this morning, California, New York City, but the entire state of California essentially has a self-quarantine order, 40 million people or so. If you're going to have employees work from home, that's great. A lot of companies are having people do that. Make sure that your IT department is ready for it and you've invested in the proper technology. Things are secured. The last thing you want is a breach of information at this time. Some employees like going into work. They like to see their coworkers. It's really up to management now to keep things lively and consider doing video conferences and just other things to try to keep people engaged as a team. We've seen employers limit visitors, of course, canceling in-person meetings, restricting all non-essential travel. If you have employees who've traveled to an area with an outbreak, you can have them stay home and self-isolate for 14 days, a couple of weeks. You can tell employees to contact HR if they or one of their family members have been exposed, or even if they intend to travel or attend large gatherings. We've seen businesses screening all visitors, asking them if they've returned from any listed country in the last couple of weeks or been in close contact with people who have traveled to those countries, if they're caring for someone who has been diagnosed with COVID, or if they're symptomatic at all in the last 2 weeks, including fever, cough, or having difficulty breathing. And if the answer is yes, they're denying entry. Federal government, prior to the Coronavirus Response Act, they issued several levels of guidance from the various agencies, all of the big three that we deal with, and employee benefit plans, IRS, Department of Labor, Health and Human Services, all issuing guidance. The IRS was the first, and they came out with this guidance, letting plan sponsors know if you have an HSA qualified plan, you can provide testing and treatment for COVID-19 without regard to whether the minimum deductible has been satisfied. So they don't want any barriers to treatment here, and so they're letting plans cover the testing and the treatment without regard to the minimum deductible requirements that usually apply to health savings accounts. Employers, whether you're sponsoring high deductible plans or other plans, determine how your insurance company or your third-party administrator is going to cover benefits for treatment of COVID, including whether any cost sharing will apply. We know that the testing is going to be at no cost to participants. Treatment may or may not be provided with any cost sharing. As of today, March 20th, the IRS hasn't changed any rules to exempt telehealth generally for non-COVID related illnesses. And so waiving telemedicine copays for all types of visits, generally speaking, could jeopardize HSA eligibility, although we have seen a lot of insurance carriers and telehealth vendors waiving the copays for virtual visits for a limited duration, 2 or 3 months. And employers with HSA plans, if you want to also adopt this and offer the no-cost telehealth visits, you may want to rely on that it's for a limited duration when analyzing if this is something that is significant enough to disrupt HSA eligibility. And if you go forward, just be aware that the IRS doesn't seem to be fully on board with this approach yet, but I think that this guidance is coming I think very shortly, maybe even in the next round of relief for coronavirus. We know that the one that was just passed is the second round. There's probably going to be a third round coming. I think that round will include a broadening of this exception, and employers will just be able to provide no-cost telehealth under HSA qualified plans, probably through the end of next year at least. We'll see. That comes to fruition. A lot of providers and physician practices are extending telehealth to their patients, and these are typically coded like an office visit. These don't really have the same considerations as the programs that are offered by external telemedicine vendors. But I think we'll see some relief there soon, hopefully. The IRS came out with tax relief as well by a notice, and then another update today, actually. So for tax purposes, the IRS considers anyone in the U.S. to be an affected person by the COVID-19 emergency. So they have delayed the due date for making federal income tax payments from April 15th to July 15th. And then just this morning, they extended the filing deadline as well for all taxpayers to July 15th. And if you're due if you're due a refund, obviously you can file before that. You should, but if you owe this year, then you can defer some for those payments, defer filing till mid-July. I mentioned this during the benefits webinar because the relief was very specific that it applies solely with respect to federal income tax payments. And it doesn't apply to any other tax or filing of any information return. So from an ACA standpoint, if you're filing your 1095Cs electronically with the IRS, you still need to do so by March 31st. If you feel that you won't be able to make that deadline, you can ask for a 30-day extension by completing Form 8809. It's automatic, simple form. You don't even need to sign it. You can just fill it out and send it in, fax it in, mail it into the IRS. You'll get a 30-day extension there, and you should consider doing that if you can't get them out timely to the IRS. Even if you are unable to get them out by the extended date, or you don't apply for an extension, you can still request to have penalties abated due to reasonable cause, although that's not guaranteed, and it's better to kind of deal with it on the front end. Centers for Medicare and Medicaid Services also came out with some guidance and reminded everyone that when we're talking about plans in the individual or small group market, those types of plans have to offer what's covered, what's called the EHB package. And it's coverage for all items and services in the 10 essential health benefit categories. So individual and small group plans that have to offer the EHB package, they will need to include coverage for diagnosis and treatment of COVID-19. And of course, the exact coverage details and the cost sharing amounts are going to vary by plan, but they'll have to provide coverage both for the diagnosis and treatment. And under the new Coronavirus Response Act, all plans, we'll talk about this more in a minute, must provide free testing with no prior authorization, effective immediately under the Coronavirus Response Act. A lot of states are encouraging their carriers to cover a variety of COVID-related services, including treatment with no cost sharing. Where I practice in Massachusetts, all of our health insurance carriers in Mass are covering the full cost of testing, counseling, treatment, and vaccination when available for the coronavirus. And this is why insurance companies have reserves. So they should have plenty of gas in the tank to take care of this. CMS also reminds us that quarantining outside of a hospital setting, like at home, is not a medical benefit. Of course, if you're receiving medical benefits like home health care, that could be covered under a plan. In that while a vaccine is not currently available, there are current rules under the ACA that require vaccines to be covered as essential health benefits. Oh, I think someone's not muted. Cover EHB as essential health benefits when it's recommended by the federal government. So when these, is someone typing? Can we just mute everybody, please? Sorry. So when a vaccination becomes available, the plans won't be required to start covering it until the first plan year that begins 12 months after the recommendation is issued, although we would expect plans to start covering it a lot more quickly than that. But eventually the vaccine will be covered as part of the ACA's recommended preventive care requirements. So the Americans with Disabilities Act, which applies to employers with 15 or more employees, generally prohibits medical exams or disability-related inquiries unless they are job-related or part of a voluntary wellness program. But now that COVID-19 is classified as a pandemic by the World Health Organization and the CDC, employers can take certain actions without violating the ADA that they normally wouldn't be able to take. So when a pandemic becomes more severe, according to public health officials, employers can kind of conclude that there's a direct threat and they can make certain disability-related inquiries or medical examinations, even of asymptomatic employees, to identify those at higher risk of complications.
I apologize. I shared my call-in number because the call was at capacity, and I did not realize that my number is also obviously the organizer number. So anybody that is calling in with a phone number that I gave you, please mute yourself so that we're not getting extra feedback and keys and so forth typing. Thank you. Sorry about that, Stacy. Hopefully that will help.
No problem. Thank you. Yeah, thank you. So what can you do as an employer? You can send employees home if they're displaying flu-like symptoms during a pandemic. You can ask employees who are calling in sick, are you experiencing flu-like symptoms? Any information that you obtain when talking with employees about this, it is confidential under the ADA. It's not subject to HIPAA. We're going to talk about HIPAA in a few minutes, but this is not HIPAA-related information. This is between an employer and employee, not a covered entity like a group health plan. And again, we'll talk about HIPAA in a few minutes. When you have employees who have visited those CDC-listed locations, you can kind of keep them out of the office, whether the travel is business or personal, for a couple of weeks. You can require employees to engage in good infection control practices, proper tissue usage, wear protective equipment. When employees come back after a pandemic ends, you can require a doctor's note certifying fitness to return for work. However, the CDC is recommending against doing that, particularly for asymptomatic employees. I think for folks who are diagnosed with COVID, you could require that, but just in general for people coming back, I think they're recommending you don't require the doctor's note. Department of Labor also released an FAQ just reminding employers of their obligations under the FMLA. FMLA, the Federal Family Medical Leave Act, generally applies to employers with at least 50 employees within 75 miles. There is an expansion of one trigger for FMLA under the COVID Response Act, and that's going to apply to all employers, even less than 50. I'll talk about that in a few minutes. But the regular FMLA is for employees who are caring for themselves or a sick family member who have a serious health condition. So, as an example, under the traditional FMLA or the new expanded FMLA, leave taken by an employee just for purposes of avoiding exposure to COVID is not protected leave either under the traditional FMLA or the new expanded FMLA. In certain cases, it will qualify under the emergency paid sick leave provision, which again I'll talk about once we get to the COVID Relief Act, Response Act, which is now. Okay, so here we are at the probably most significant piece of legislation so far on the COVID-19 virus, and that is the Families First Coronavirus Response Act. This was passed by the House over the weekend, last weekend. It was adjusted Monday morning, and then the Senate passed it on Wednesday, and President Trump signed it into law on Wednesday evening. And it includes a couple of types of emergency paid leave, paid FMLA leave, paid sick leave. It includes free testing for the coronavirus and increased funding for unemployment assistance to the states, food aid, and Medicaid assistance to the states. So two of the main provisions that we're going to focus on here are the emergency FMLA provision and the emergency paid sick leave provision. These are two separate provisions, each of which are triggered differently. So they apply to employers with less than 500 employees and public employers of any size. The paid leave provisions are effective no later than 15 days after enactment, and they sunset at the end of 2020. So it's very temporary here. Compliance is required no later than 15 days after enactment, but you can rely on it immediately to start providing the paid leave under these two provisions. Don't wait longer than 2 weeks to start complying, but if you wanted to apply now, you'll be able to avail yourself of the tax credits that are there to assist employers in paying employees. And that's really why I think that Congress drafted this to apply to employers with less than 500 employees, is that there are tax credits under the law to help you pay your employees during this time. And the smaller employers or the mega large employers are the ones that I think need it most. The way they're providing the tax assistance is by a refundable payroll tax credit. So this is good news for nonprofits. They wouldn't benefit from an income tax credit. They don't pay federal income taxes. And so this makes it easier for nonprofits to qualify for the credit. We think it's going to be done quarterly through the quarterly Form 941. You can also include health insurance premiums as part of the wages that you're paying to employees to get the credit. So as an example, if you have some employees that are out that are qualifying for this emergency paid leave and their payments aren't fully utilizing the employer's available tax credit, and the employer is also continuing that employee's health insurance, the employer can use the money they're paying toward the health insurance to kind of, treat it as wages for purposes of the tax credit. So in other words, whether it's given to employees in salary or health insurance up to the permitted limits, the employer can get a tax credit for it. And there'll be more guidance on how to apply for this tax credit within the next couple of weeks, I'm sure. The coronavirus testing. So until the end of the public health emergency as declared by Health and Human Services, all plans, whether they're individual or group health plans, must provide COVID-19 testing with no cost sharing or prior authorization requirements. We're hearing that the carriers are providing this primarily in-network with no cost sharing. We're hearing that some are charging cost sharing for out-of-network um, visits for COVID testing. Self-insured plans that are worried about out-of-network providers charging for COVID testing, the plan would still only pay the reasonable customary amount, so they shouldn't get stuck with a big testing bill from an out-of-network provider, although the participant could be balance billed if they're going out-of-network. In terms of the testing, there seems to be a national shortage of testing materials. Access to testing might be limited to those who meet certain criteria established by the different states' departments of health. Public health officials are telling folks if you're symptomatic, call your doctor. Don't show up at a facility and ask to be tested. And we're hearing that in many cases, providers are telling folks not to come in. Certain people, if they're symptomatic, and just stay home for the time being. So getting into the first of the two paid leave provisions, this is the Emergency Family and Medical Leave Act provision. And if you were following this bill a week ago and looked at it when it first passed the House over the weekend, it was much more expansive than the final version. The final version is very limited, and you'll see what I mean. So this amends the FMLA to temporarily or to provide 12 weeks of job protected leave for a qualifying need that's related to a public health emergency. And this is for all employees who have been with you for at least 30 days. Normally, FMLA has a longer runway before it applies to a new hire, but this is for anyone that's been with you at least 30 days. They can get paid leave if they're unable to work or work remotely because they are caring for a minor child because the child's school or daycare center or daycare provider is unavailable due to a public health emergency like COVID-19. So very limited, not caring for a sick child with COVID, that would be covered under FMLA, but unpaid under the traditional FMLA, wouldn't be paid under this particular provision. There is paid leave under the emergency sick leave that would cover it, but not the expanded FMLA. I'm not exactly sure why they did it this way, but at any rate, this one, you'd have a 10-day elimination period. And then after the 10-day elimination period, an employee who is home caring for a child who is home because their school shut down or their daycare center shut down, that employee would be paid at 2/3 of their regular rate of pay based on their normally scheduled hours, capped at $200 per day and $10,000 in total. So basically a $200 a day benefit. Employees can, but are not required to, use paid leave during their elimination period. So that is a relatively discrete benefit. The trigger for it is you have to stay home caring for a minor child whose school or child care provider is unavailable due to COVID. For this law, or this provision of the law, typically FMLA, like I said, doesn't apply until you have at least 50 employees. This emergency FMLA provision, though, applies to all employers with less than 500 employees. The Secretary of the Department of Labor is authorized under this law to make exceptions for small employers if you have less than 50 employees, and providing the leave would jeopardize the viability of your business as an ongoing concern. You'd have an exemption, but this will have to be drafted. This will have to be implemented by regulation. It's not automatic, and so if you're wanting to kind of avail yourself of this exception, you really need to wait for guidance to ensure that you really would qualify, unless you're willing to take a bit of a leap of faith and you're pretty sure that you're going to be unable to make these payments. Considering that you have a delay of your tax payments, you have tax credits to help you make the payments. When the laws contain exceptions for these kinds of things, they're often pretty rigorous, and they might require proof that it would jeopardize the viability of your business, not just like, geez, I can't do this. This is too much. That you might actually need more than that, real, proof of that. There are other exceptions to the reinstatement requirements if you're a small employer, less than 25 employees, and the position no longer exists after the pandemic ends. They're not going to consider that an FMLA violation. And there is an exclusion also for employers that are the employers of healthcare providers or emergency responders. They get exempted from this emergency, or they can exclude those employees from the emergency FMLA entitlement. I think there are already measures in place for providers and emergency responders for their kids to be watched while they're working, and so that may be why they're excluded here. So this is the other piece. Okay, this is the emergency paid sick leave provision. This is where the law provides paid sick time to an employee who is unable to work either at the office or remotely because the employee is subject to a quarantine order, either at the state, federal, or local level, or the employee has been advised by a provider to self-quarantine, or the employee is just symptomatic and he's seeking medical diagnosis. So you see the first three here are specific to the employee, and we'll talk about that one on the next slide because the benefit is different depending on whether the individual is caring for himself or a family member. So here, emergency paid sick leave, this is the one where you get 80 hours. I'll go into detail more on the next slide, but it is triggered when there's a quarantine, either at the state, federal, or local level by the employee's doctor, or even if the employee is symptomatic. And so for number three, you could certainly, number 2 and 3, ask for proof if you feel that the employee is just, he's just staying home and trying to avoid exposure, not under a quarantine order, that wouldn't qualify, okay? Also, if you are home caring for someone who is subject to a quarantine or isolation order, or like the FMLA, you're caring for a child because the school or daycare center is closed due to COVID-19, that also triggers payments under this emergency paid sick leave provision. Here, the employees are entitled to up to 80 hours of paid sick leave. It's prorated for part-time employees. In this one, all employees are immediately eligible for this leave. You don't have a 30-day work requirement. Upon date of hire, this would apply. This leave is paid at the employee's regular rate up to $511 per day, that grand total of $5,110 in the aggregate, when the leave is taken due to the employee's own illness or quarantine. It's paid at 2/3 of the regular rate, up to $200 a day, $2,000 in the aggregate, when the leave is taken to care for others. So this would basically, be used during the elimination period for the expanded FMLA leave if you're caring for a minor child. So that's the benefit. I think there'll be more coming for the American people. I don't think the government's going to be able to stop with that, but that's what they were able to agree on and get passed into law earlier this week. So I have 2 more slides on benefits issues and some common employment issues that we're seeing, and then we'll open it up to your questions. What happens when employees are laid off? You need to really look at your plan documents. There's not a one-size-fits-all approach. Generally speaking, if when there's a reduction in hours, then in coverage is lost, then COBRA applies, and you need to send out a COBRA notice. If of course, if you're still maintaining your group health plan. There are some issues with the employer mandate. If you're a large employer and you have employees in a stability period, if they remain employed, you could still be on the hook for having to offer affordable coverage, which you could always do. If you're offering paid leave or subsidizing COBRA premiums, you can certainly do that. I mentioned earlier that information provided to an employer by an employee is not subject to HIPAA. It has nothing to do with the group health plan. It's not created, maintained, or received by a covered entity. So it's not HIPAA covered information. Of course, even if it's not subject to HIPAA, you want to treat it as sensitive personal information. It is probably subject to confidentiality requirements under the ADA as well, as I mentioned. So the employee comes and tells you that I'm self-quarantining because I've been exposed to the virus. That's not HIPAA covered information. I'll explain a little bit what you can do with that information in a minute or two. As an example, though, if you were to query your own health plan to look at claims to see which employees had the virus, that information would be subject to HIPAA because it's coming from the group health plan. Another very common question that we're seeing is what happens with dependent care FSA elections. Can we stop them? Can employees stop them when the school is closed or the daycare center is closed? And the answer is yes. These are changes in cost and provider cost, and that allows a change under a dependent care FSA. It does not work for a healthcare FSA election. Changes in cost or coverage do not apply to health FSAs, and that's why we usually don't see a lot of health FSA election changes during the year. But dependent care, dependent care FSAs, they can use those rules for changes in provider cost, and so when the daycare center is closed, the employee can stop making the election to contribute to the dependent care FSA. From a benefits perspective, we don't always differentiate that much between a furlough and a layoff. I think typically we think of a furlough as a time where benefits are going to be continued, and a layoff would be more like a termination of employment where benefits are terminated and COBRA would be offered. So COBRA is offered when you have a reduction in hours or a termination of employment that results in a loss of coverage. So you're laying employees off and you're still maintaining a group health plan, you need to offer COBRA. Even if you're not going to maintain a group health plan anymore, you would need to send a notice of unavailability if you're over 20 employees and you're subject to COBRA. And if, technically speaking, if you want to fulfill your notice requirements. When do employees lose eligibility for benefits? There's not a one-size-fits-all approach. It depends on the terms of the plan, what the employer is willing to do, any concessions or accommodations that the carrier is willing to make. We're seeing, for the most part, the carriers are saying as long as premiums are paid, coverage can be maintained. I think we're even seeing some carriers offering, payment plans or letting employers possibly sliding on the bill in certain cases, or delay payment for a month or two. In terms of employee contributions, you can cover employee contributions while they're on leave and have employees repay them upon return as long as they agree beforehand. You could require employees to remit contributions during leave to maintain coverage. It's another option. In terms of employment issues, do we have to pay employees out on leave? Generally, for salaried employees, if they work at all during the week, you have to pay them for the week. If you tell them to stand down for the week and they're not doing any work at all, you could potentially not pay them. Hourly employees, if they're not working, then they don't get paid, other than the paid leave that we talked about a couple of slides ago. What can we do if an employee informs us that they've been exposed or tested positive for COVID-19? this is going to happen. You would shut down the office or area where that individual worked and heavily clean and sanitize it. And you'd have to identify coworkers who might have been exposed. You would also inform those coworkers. You should not identify the employee unless the employee says, hey, look, you can tell people, don't worry about it. I want everyone to know, tell them it was me. There was no stigma attached. That's okay. But typically you would not want to identify the employee. Certainly not with their permission. There's confidentiality requirements, but you would inform affected coworkers, hey, you worked in an area that was visited by either an employee or customer that was exposed to the virus. We recommend you talk to your healthcare provider and that you self-quarantine at home for at least 2 weeks. Then you just encourage employees to contact HR with questions and let them know that further information will be forthcoming. So that brings us to the end of my paired piece. We can open it up now to questions. Hopefully this was helpful.
Okay. Yes, lots of information, very, very helpful. And we do have several questions in the chat that I will send to all so that you can take a look at those. And then also I will open it up at this time for people to ask their questions. So I'm going to unmute our callers and see how that okay, trying to unmute all. Okay, did that work? Okay, I apologize. That doesn't appear to be working. If you have a question, if you would please, there is a chat room as well as a questions box where you can submit your questions and we can ask have Stacy go through those at the time. So, okay, Stacy, are you able to see the question box? Okay, it appears I have possibly muted everybody. Stacy, are you back with me? And Nicole?
I am.
Okay, I apologize for that technical difficulty there. Are you able to see the questions in the chat?
I am not.
Okay, then I will put on my reading glasses. Some questions that came up yesterday that we need answers on. Scenarios where employees would be working part-time, would they be able to claim unemployment? And then the second part of that, well, why don't we stop there?
Would they be able to claim unemployment? Yeah, my understanding is yes. And in Massachusetts, they're expediting unemployment for people who've been laid off. So I don't know, you may find that in Texas. It's always subject to state law. Unemployment's run by the state. But yeah, I believe anyone who's going to be laid off would be able to get unemployment.
And then what are the max hours before you can claim unemployment? Please find out other clever ideas and also pitfalls of what companies are doing and asking about going to have to get ahead of this. So I guess it's just really clarifying the number of hours that would be eligible.
I'm not sure. I don't think I can answer that one.
Okay.
They probably need to look at the state resource front.
Yeah. Okay, the next question is, how does an employer apply for the exception for small employers?
So there's there's no application process yet, and the law doesn't even directly exempt the small employers. It authorizes the Secretary of Labor to come up with that process. So they probably will, but they haven't yet. And you would probably just look at the facts and circumstances and say, look, this is going to seriously jeopardize my business as an ongoing concern if I provide this leave. But again, I mean, I would be very rigorous about it, and I would maintain proof, and really consider it and talk to legal counsel before you take the position that you're going to treat this as not applying to your employees, because it's a wage violation under the FLSA if you don't, and there's probably significant liability. So talk to counsel before
Okay.
you do that.
Okay. So the next question, and this makes sense, under the emergency paid sick leave, if an employee is home to take care of a child because school is closed, the child's not sick, is the employer not required to provide the sick leave if the employee is able to telework?
No, because we're talking about, the parent may have to, watch the child and can't just, dedicate time to teleworking if they're home because the child is quarantined. So the employee could say, look, I'm unable to telework. I have a minor child. I have a 6-month-old or a 3-year-old or something, and I can't just telework at all. I mean, if I had to take care of either of my kids, I wouldn't be able to do anything. So I don't think that would work.
I apologize. If the child is just at home, not sick, but is at home because school is closed, which is the case with everybody, then the employer would not be required to pay, because there's nobody sick. So I guess they would have to show, possibly at some point some documentation.
Let me go to the slide, because this is picked up under the emergency leave. So a qualifying need is when the employee is unable to work to care for a child because the school or child care center is closed. The child doesn't have to be sick. The child just has to be home because their normal place of care, daycare or school, is closed. And the parent says, I can't work from home. I can't work at the office. I have to take care of the kid. Then that would trigger a coverage under the Emergency Family Medical Leave Act provision.
Okay.
This one is for people that are sick or subject to quarantine or isolation. The emergency paid sick leave, the 80 hours, that requires, some kind of quarantine or sickness, Actually, I'm sorry, I misspoke, because number 5 also, again, is simply, just if you're caring for a child because their daycare center or school has been closed due to COVID-19. So the child does not have to be sick in order for payments to be triggered under either of these provisions.
Okay. Wow. Okay. Next question. Under the emergency paid sick leave, if an employee is home to take care of a child, I apologize, I think that's the same one I just read. Is it possible to get a digital copy of the presentation slides? And yes, we will be posting this on the mybciteam.com, and there's an icon at the top, which is our hub, our coronavirus hub, and this presentation will be made available as a resource for you at that hub, on the hub. Next question. What if we are required to close our business, a daycare center, by the mandate of government with no revenues? Do we have any obligation to pay the emergency sick leave or emergency FMLA because 100% of our employees would have been let go with no wages being paid?
Yeah, it's a good question. I would think not. The bottom line is these are for employees. If you're just terminating everyone, treating it as a total termination and closing the doors, and you're paying out accrued vacation time, and that's I, I don't think so. I think you'd probably want to talk directly with counsel in that situation,
Mm-hmm.
so you can have
Okay.
really review the facts and give you direct advice.
Okay, good. Okay, next question. Would being furloughed and continued benefits affect qualification for unemployment versus being laid off?
I don't know. You have to check the state unemployment requirements and how they would treat it. It differs by state.
Okay.
It'd probably be an offset, but I don't know that it would preclude someone from getting unemployment. I think at most it'd be an offset.
Okay. Okay.
But
Next question.
Really,
Can an employer
go ahead.
Can an employer start offering the emergency paid sick leave and expanded FMLA now and not have to wait until April 2nd, 15 days after enactment?
Yes, definitely. So it's kind of effective no later than 15 days. So meaning you can rely on it immediately. You can provide leave in compliance with these requirements and get the tax credit, starting now or yesterday. You don't have to wait 2 weeks.
Okay. Okay, here's another question. It's some of them are very similar, but I'll go ahead and read it, Stacy. What if we are reducing all staff hours because of a lack of business and are offering employees the option of taking unpaid time off? Do the emergency sick leave or FMLA still apply if our employees or their dependents are not sick? Isn't this just an unemployment issue?
I mean, I would think it would still apply. I didn't follow the question in the sense where it wouldn't apply to the employer. If the employee is taking qualified leave, and they're not otherwise paid by the employer, then they have entitlements under either of these two leaves. Again, if the employee is home, they can't work because their children are at home because their daycare center or school is closed due to COVID, then it triggers payments under these laws.
So, and I'm not sure if the direction of this question is around if they're taking unpaid time off, I mean, not due to the virus, but they're just taking time off on their own. I guess, I don't know if maybe that's where the question is directed from, but I think we'll leave it at that unless you have something more to add to that. And we have quite a few questions as well.
On their own, then they wouldn't be covered under this. It has to be in relation to COVID.
Mm-hmm. Okay. All right, next question. For FMLA purposes, will they be looking at common ownership of companies, taking into account the 50 employee limit similar to what they've done for the ACA?
So that is something that is not directly addressed in the law, but I think we'll get more guidance on the way that I approached it. I don't think they're going to use the IRS test because this is based on FLSA and FMLA guidelines, and under the FMLA they use what's called the integrated employer test, which is a lot like the Section 414 control group rules for retirement plans and for ERISA plans, but it's not exactly the same. It's more of a facts and circumstances determination. But I think that's what they're going to use. I could be wrong, but I suspect we'll see guidance on that. I'm sure we will, because they're going to have to define exactly who is eligible for the tax credits. What point you become ineligible for the tax credits.
Okay. All right. Another question similar to above. Do we have to offer the paid sick leave within 15 days of the president signing the bill?
Yes.
right. Some people just have indicated that they have a question that they wrote into the question box. If you have a question, you need to write it in. We have several questions, though. I'm going to try to get to all of them. We'll see how many we can get through. How do the COBRA-related issues apply to non-COBRA groups?
You'd probably be looking at state continuation laws. And I think a lot of states, and I think Texas does, have a mini COBRA law where there'd be similar opportunities for extension as long as the group contract is remaining in place. But if the group contract is terminating, then there won't be any mini COBRA.
Okay. All right. The next question is reads, do we require documentation if exposed to the virus or tested positive?
I think you could, and it's hard to say. I mean, I would think so. To be honest, I know that they're suggesting not, but I think for someone that was diagnosed with it, I would think so. I mean, you wouldn't have to get a form, but I think you'd be within your rights to, and I think you probably would.
Okay. Is there a process established that? Okay. Yeah. Go ahead.
Sorry, I just have time for one more, and then I got to jump to another call.
Okay. I'm just going to, next one in order is there a process established that would determine payroll credits for COVID-19 employees?
Not yet, but there will be. It almost certainly will be through Form 941, the quarterly returns. I think we'll see guidance within a couple of weeks. But there definitely will be guidance on how to claim that.
Okay. Well, we've reached the end of our call, everyone. I apologize I didn't get through all of your questions, but if you will please work through your producer or account manager at Benefit Concepts with your question, we will certainly get back to you with a response as soon as possible. Again, thank you for joining. Thank you, Stacy, for your time and dedication in providing this informative information to us. Everybody stay safe and healthy, and have a good rest of the day. Bye-bye.
Thanks, Kirsten. Thanks, everybody, for joining.
Thank
you.
Thank you.